Hello, my name is Cecilia. I'm a registered dental hygienist with 24 years of experience in general dental private practice. The following is a review of public health efforts that have been used for many years to decrease the rate of dental decay at the population level. What causes dental decay? The causative factor is high intake of sugar. The optimal pH of the oral cavity is 6.7 to 7.2. Dental caries can start to develop at a pH of 5.5. After sugar consumption, the pH in plaque can fall rapidly to 5.0. Through production of acids by bacterial metabolism, predominantly as mutants, there is loss of tooth material, which depends on the exposure and frequency of consumption of sugar-sweetened beverages, soda, and fruit juices, which are some of the primary sources of added sugars. Prevention of decay depends on meticulous hygiene and low consumption of sugars. These are some decay prevention methods used currently in community health, which are included in my review and the fluoride content expressed in parts per million. For reference, the content in regular toothpaste is between 1,000 and 1,500 parts per million. The method and frequency of application depends on the type of fluoride used. Varnish can be applied 4 times a year. Silver diamide is used to prevent and arrest decay and can be applied depending on need or 2 times a year. A dental sealant is a thin plastic coating that is applied to molars and premolars to block the chewing surfaces from bacteria. Oral health care is important for overall physical, emotional, and psychological well-being. Health disparities affect mostly the low-income, uninsured, and minorities, and determinants such as education and income can influence health-seeking behaviors. Also, a Medicare system that does not provide preventative services can further complicate access to care. Historically, the medical and dental delivery systems have operated separately. Northridge et al. Proposed an ecological model to close the gap in healthcare disparities. To address this issue, dental preventative services have been offered in school settings, and a model of prevention has been introduced in primary medical offices, which has shown improvement in access to care. Currently, other community-based oral health intervention programs to reduce the rate of dental decay are fluoridated water, the delivery of dental preventative services in preschools, daycare centers, and elementary schools, as well as the taxation of sugar-sweetened beverages. According to Sokai et al., since 1945, water fluoridation has been the most impactful and most equitable health program. Studies have shown that populations from lower socioeconomic status in communities with fluoridated water have a lower rate of dental decay, and this has demonstrated to be the most effective population-based tool in the prevention of dental decay. Deyes et al. Reviewed high fluoride vehicles to prevent decay in children and elderly and their delivery in medical facilities and at home for the homebound. Fluoride varnishes and high concentration fluoride toothpaste have been considered for incorporation into community-based geriatric programs and well child visits in primary healthcare settings. In the U.S., Medicaid programs in 43 states reimburse medical providers for preventative dental services that include varnish application, and community-based interventions have been developed to train dental providers as well as non-dental providers to deliver fluoride varnish treatments and dental education to the underserved. Horst et al. Reviewed interventions such as fluoride, sealants, and antimicrobials for different stages and recommended places where these methods can be incorporated, such as WIC and long-term health facilities. They emphasized that prevention should aim to alter dental plaque biofilm, improve the resilience of teeth, and promote the reduction of dietary sugar. This by Da Silva et al. Reviewed 38 studies of interventions with children and suggested that programs that used a variety of interventions such as oral hygiene education plus fluoridated toothpaste, chewing gums, supplements, training of non-dental professionals, fluoride rinse, and fluoride varnish application resulted mostly in positive impact in reducing decay. A national survey conducted by Bakuri et al. Reviewed school-based fluoride varnish programs. The study was done to identify gaps in the delivery of preventative services and evaluate the cost-effectiveness, sustainability, and to set up guidelines for school-based fluoride varnish programs. Results of the study revealed a lack of uniformity with protocol and funding. The effect of fluoride varnish in reducing decay in high-risk children and reduction in hospitalizations to treat carious lesions was the purpose of a review by De Souza et al. The results conclude that fluoride varnish showed a modest but uncertain anti-caries effect in preschoolers. No studies reported caries-related hospitalizations. A comparative study by Keller et al. Evaluated the efficacy of fluoride mouth rinse and fluoride varnish administered by dental professionals for a 2-year period as interventions in school-based programs to decrease the risk of dental decay in children 6 to 12 years of age. Both school programs performed equally and no significant differences in caries preventive effectiveness were found. Marino et al. Conducted a review of the literature of 37 trials that tested the effectiveness in caries reduction of fluoride mouth rinse with children and adolescents in schools. The results indicated that supervised regular use of fluoride mouth rinse can reduce the rate of dental decay, and the findings of the study may be applicable to programs in other settings. The impact of taxes on sugar-sweetened beverages on the incidence of dental decay was reviewed by Al-Hareki et al. Increasing taxes should result in a reduction of consumption that would create a positive impact on health and in lowering the economic burden due to dental decay. Silver diamine fluoride is the newest treatment that is offered through community interventions. It can prevent and arrest decay, and its low cost and ease of use makes it ideal for dental and medical professionals to administer it in non-dental settings. It is ideal for those unable to tolerate invasive treatment, such as children, the elderly population, and medically compromised patients. Dental disease is the most common and the most preventable chronic disease. We have made progress with community interventions, but more programs need to be created to increase access to care and end the disgrace of poor oral health as the national symbol of social inequality.